Dana Lands, and I'm the Nursing Director for Women's and Children's Services here at St. Bernard's. One of the departments that I have is the Newborn Intensive Care Unit. So the Newborn Intensive Care Unit consists of 19 beds. That's a recent expansion that got us to 19 beds. We take care of critically ill newborns down to about 27 weeks, 26 weeks. We don't usually put a gestational cutoff to kind of think about what kind of patients are in the NICU. These are newborns that are born with a wide range of health problems. So it could be problems with breathing, they may have a heart defect, they could have issues eating, or they may just be premature, which is what most people think about when you think about a NICU. So the NICU was built in 2012. St. Bernard's saw the need based off of the fact that we were transferring out about 100 babies a year that needed that higher level of care, and there's nothing else in our region like it. So when we opened, we thought 6 beds sounded like a great idea, and then maybe 12, and we rapidly filled those up. We stayed at capacity last year for about 45% of the time. So we saw then we've got to do something. We don't want to turn these families away. So we opened up to 19 beds just a few months ago. It's been great to see that expansion happen. Because of that, also, we were able to add a NICU transport team. So this is a group of specially trained nurses, respiratory therapists. We have a nurse practitioner on board as well, and they're able to go out and transport babies from outlying facilities that don't have the level of care that we have here at St. Bernard's. So they've gone to Paragould, Batesville, Blytheville, Newport, as far as the Boot Hill of Missouri to bring babies back to take care of here. So the benefit obviously is to our community with that. You know, if you've ever had a sick child, these moms, you don't want to be away from your other children, your job. It's a financial strain, it's an emotional strain. So we love the fact that this unit is here for them. They can be closer to home. We can go get the babies and bring them in. So a little bit about the NICU too, if you think about the crew that we work with in there. Now it is over 30 specially trained RNs. We started with 10, so it's been a lot of growth over the last few years. We have respiratory therapists that are dedicated to the Newborn Intensive Care Unit. We utilize social work, dietary, speech and physical therapies. We have 3 board-certified neonatologists that are our physicians that take care of the babies in there, along with 2 nurse practitioners. So it is a very busy, happening unit. A lot of people don't think about, there's that many sick babies at any given time that need that level of care. So today, for instance, we have 15 babies, and we're bringing 2 more in on transport. So just an idea that, it is a very busy, active, intensive care unit, even though it's for our smallest patients. Just to talk a little bit about labor and delivery, not all of our NICU babies come from our labor and delivery because we do bring them in from outlying areas, but the majority of them do. So last month here in labor and delivery, we had a record-setting month, not just for recently, but for as far back as we've been counting. We delivered 177 babies in 1 month. And if you look at the statistics, about 11% of all babies born need intensive care services. So we're very thankful to be able to offer that right here at St. Bernard's.